Every year, more than 48,000 babies are born before their time in the UK. Sometimes the obstetricians have to deliver babies early, and other times babies just arrive unexpectedly.
I had to have an emergency cesarean because his heart rate was 170 and it dipped to 30, so they had to get him out pretty quick.
It was all a bit of a shock really, because I'm just getting used to being pregnant and the thought of, hadn't really brought anything, and then next thing we know we've got a baby.
One minute I was doing the weekly shopping and next minute she decided she was on her way.
If parents are aware that their baby will be born early, the staff in the maternity unit can help to prepare them for the time that lies ahead.
Usually by invitation from the obstetricians or midwives, we'll go and speak to the parents. We'll tell them a little bit about what to expect at the delivery, who will be there, and the process of resuscitation and stabilisation, but we do make an attempt to explain in broad terms, particularly at the very margins of viability at 24 weeks. First of all, the risk of dying for a baby born at that gestation, and then the risk of neurodisability later.
As soon as these very small babies are born, their conditions are stabilised while still in the delivery room, and then they are transferred to the special care baby unit. This is baby Aidan. He was born 9 weeks ago by caesarean section at 27 weeks of pregnancy. He weighed less than a bag of sugar.
1 pound 10.5 ounces.
His mum thought something was wrong when she couldn't feel him kicking.
He used to kick after I'd eaten, and when he stopped kicking after I'd eaten, I actually gave him a call and said, this is not right. And they said, drink a glass of water, try that. If you don't feel anything, come in. Didn't feel anything, so I came in. Had a lot of scans, a lot of people monitoring the heart rate and everything, and they said what was happening was he's got a heart rate, so he was still alive, but he was in distress because he wasn't moving. And I went to the hospital about 8 o'clock in the night, and by 12 minutes past 1 I'd had an emergency C-section and he was born. So they said it wouldn't have been much longer before we'd lost him really, didn't they?
Aidan now weighs 3 pounds 12 ounces. For the first 7 weeks of his life, he was on a ventilator, where a machine did the breathing for him.
He was eventually taken off the ventilator nearly 2 weeks ago now, since when he's been on nasal CPAP that you can see him on today.
The CPAP is a system that blows air into his lungs at a regular rate. His oxygen levels are recorded constantly.
When you watch him breathing, he's breathing a little bit faster than you might expect, and he's sucking in under his ribs, which we call recession, and that reflects that it's quite hard work for him to breathe. His lungs are small and immature and rather stiff, so inflating them is harder work for him than it is for you or I, and that's how the CPAP machine is helping, but it still is hard work.
It's also tiring for Aidan's parents.
Sometimes you feel a bit helpless, because sometimes you can't really comfort him, or you don't know what's wrong with him, and
It's a bit like yesterday when his nasal prongs fell out and got sort of caught, and we're trying to get them back in, and he's crying his eyes out. We were running around like idiots and trying to comfort him, and he kept knocking them out, and there was just nothing we could do really, was there?
No, it's quite difficult when something like that, yeah.
Aidan still has a long way to go before he can go home.
Over the next few weeks, we'll be aiming to gradually increase the periods of time that he tolerates off of CPAP, and eventually he'll be able to come off the CPAP machine altogether, perhaps with a bit of extra oxygen that we place in his nose. And at that point he'd be able to move through into nursery 2 next door, where we continue to support his growth until he's fit for discharge home.
The other problem for very premature babies like Aidan is that they cannot suck at a breast or bottle and have to be fed by other means.
He's got a tube down through his nose that's passed through into his first part of his small bowel, and we're giving him his milk through that tube so that he tolerates the volumes that he needs to have to enable him to grow.
Mothers can express their breast milk using a pump so that their baby gets the best food possible.
I'd anticipate that he'd be here until at least the date he was due to be delivered, and probably a little bit beyond, and that'll be largely determined by how quickly he learns to establish feeding once he's stronger and able to be off the CPAP machine.
We're still finding it difficult You know, it's just an ongoing thing every day, you know. Backwards and forwards to the hospital, you know, juggling work as well.
This is Beth. Like Aidan, she has a tube to give her milk. She was born 2 weeks ago, 3 months early after her mother Gianna went into premature labour.
It's been quite a shock, quite an adjustment, because I literally had bought nothing, so it was a quick dash to the shops. Just one of those things. She decided she was coming out. I started having contractions. I think my waters had gone before, a few days before, and yeah, I started having contractions, and then it was really fast. 2 hours later she was born.
Despite only weighing 2 pounds 5 ounces, she was in good condition and had very little difficulty with her breathing.
She was fortunate in that she had very minimal lung disease and required a period of nasal CPAP in our intensive care room, but is now breathing independently and her lungs are better. So she's been brought through to this room where she's just having her feeding supported with gastric tube feeding, aiming for her to gain weight.
Initially she lost weight, but as all babies do, but now she's pretty much back to her birth weight, so we just have to get her some weight on now so she can regulate her temperature.
All babies brought to the special care baby unit are attached to an array of monitors which assess their condition constantly.
To start with, it was quite scary to see all the tubes and hear all the beeps and everything, but you get used to it very quick because you just focus on her and the fact that she has to get better, so you have to remain calm as possible for her. But she was whisked up here, and yeah, they said she was strong, she was fighting, and since then she's just thrived so well. She's been really, really good, considering she was so early. She's a strong woman.
Not all babies brought to the special care baby unit are as small or premature as baby Beth.
Good boy. Good boy.
This is Sonny. He was born 5 weeks early.
He was born 5 pounds, but he lost 10% of his body weight. But that's normal. His cardigan's from a dolly shop because no clothes are fitting, so Darren went and got it from the dolly shop.
So Sonny was delivered at 35 weeks gestation because his mother had a condition called pre-eclampsia, which threatened her health. So the way to manage that was to deliver Sonny. So he was born at 35 weeks and had no problems with his lungs because of that, being relatively mature. So now he's with us just learning to bottle feed, and we're supplementing his bottle feeds with tube feeds. But he's now managing to take about 50% of his feeds by bottle, and he's doing very well.
If he gets tired, because we don't want to wear him out at the moment, then he gets it put through his little tube. At first he was always tired and he didn't take his bottle much, but he's got much better now. Yeah.
Sonny also developed low blood sugars shortly after birth, which meant that he had to be given a dextrose drip. There are 2 ways in which this can be done.
Depending on the condition and the size of the baby, we'll usually put a drip in the baby, usually in the back of the hand, much like you would see in an adult. Or we can also use the umbilical cord to pass catheters into the blood vessels that allow us to measure the baby's blood pressure accurately and withdraw blood samples without having to prick the baby to get blood from them.
Sonny has made good progress, and as soon as he is taking all of his milk by bottle, he will be allowed home.
Typically, we say to parents that they should expect to take their baby home at about the time it should have been born. In general, that means they're not disappointed. Often babies born, particularly above 28 weeks, will be able to be discharged some time in advance of the date they were due to be born. On the other hand, babies born at the extremes of prematurity, below 26 weeks, can often be longer because of the complications they've developed.
For Aidan, the stay in hospital will last several months. But despite the difficulties, Annette and Tony get on with being his mum and dad.
We get cuddles, we get to change his nappy, clean him up a bit, but you know, he's there, he's alive, and you know, we're happy. We are
That's
pleased.
the main thing, isn't it?
Yeah, I mean, he's my little boy. You know, chuffed to bits. As I say, he really, you know, as I say, just because he's small. I mean, yeah, I wish he was bigger. I want to hug him, I want to take him home. But no, I'm glad he's still there, and I'm glad he's like, you know, he's doing as well as he is at the moment. I'm really pleased.